Hi, it's Dr. Mary Tipton from Blossom Health, a direct primary care practice in West Jordan. So, what about Medicare? What are we going to do with these Medicare patients? Well, I tell you, it's been breaking my heart to go to clinic for the last few weeks and talk to my Medicare patients because they are really distressed. They're distressed that this program that they were told would give them high quality care with great doctors when they're in their senior years and they don't have very much income, they were told that that would work, and it's sort of not working. And the biggest problem is because they just don't have access. They don't have access to enough physicians because the reimbursements and the Medicare program are so onerous and challenging that many doctors have opted out, or they're capped in the amount of Medicare patients they can take. So, what to do? Well, first of all, I will be opting completely out of Medicare. Medicare does not allow you to be half in or half out. You have to completely opt out, and it's quite a process. And once you do, you are completely out of Medicare for a minimum of 2 years. My opting out from Medicare will be starting July 1st. So even though Blossom Health is opening June 1st, it won't be until July 1st that my Medicare patients can actually see me and help me not break the law, because they're going to need to sign a paper called an advanced beneficiary notice that says, like, we know that Dr. Tipton does not accept Medicare payments, and I pledge that I will not try to submit a bill. This is the patient saying, I promise that I will not submit a bill for any of these services to Medicare that Dr. Tipton provides. And same thing with me. Of course, I'm saying I'm not going to charge Medicare any money and accept any money from them. But I can see Medicare patients. I absolutely can. And I'm going to have a status called ORP. That means ordering, referring, prescribing. So I can do ordering, referring, prescribing, referral coordination, all types of care for my Medicare patients if they pay the monthly membership fee for Blossom Health. I do love my Medicare patients, and I personally feel it's a tragedy that they have been kind of sold a bill of goods that this would be such a great program for them. And many find that the costs are high and the access is poor, and it's just really discouraging. So I will pledge to continue seeing Medicare patients, but they just have to realize that it wouldn't cover the office visit fees. Another thing I want to say about Medicare. Medicare has different parts. There's Part A, which covers inpatient hospital stay, Part B, which covers outpatient visits, and then other parts. Sometimes people call a Part D, which covers medications, but that's actually like a supplemental part to Medicare. Anyway, there's also called Medicare Advantage plans. There's also these Medicare Advantage plans. Now, that's different than traditional Medicare. With traditional Medicare, you might not know that there is very few restrictions on who you can see. You can see virtually any hospital, any licensed provider, and there's actually very few prior authorizations. So Medicare itself, just traditional Medicare, actually has less restrictions, but these Advantage plans have popped up. Now, these Advantage plans are run by really big businesses like United Healthcare with AARP, or Intermountain Healthcare has a Advantage plan, and so on. And the Advantage plans will promise our seniors that they can have all these perks. Now, that could be dental coverage, that could be groceries, that could be a gym membership, that could be like gift cards that come in the mail if you do extra visits. And it also requires you to choose a primary care provider that's in network. So when you're selecting this supplemental coverage, or when you're selecting a Medicare Advantage plan come up this October, November during open enrollment, you'll want to be sure that you choose a plan that allows you to see any provider. Another way to look at it is that you'll want to avoid the M words. So what do I mean by that? Well, if you hear the word managed plan or health maintenance organization, HMO, those M words really mean that they are trying to manage you and manage me if I was a network provider. So managing is like a euphemistic term for restricting care, for limiting the network of providers, the type of services. There's usually a lot of prior authorizations in these managed plans. And by managing these plans, that's M word again, they are saving money, so to speak, and then redirecting it towards these other perks. But it may really not be the best care for you because of your restrictions. meaning you can't see the doctor you want, or there isn't any doctors in that network taking patients. So you're going to want to avoid an HMO or a managed care plan and opt for something called a PPO. Usually that's like a preferred provider organization or some type of traditional Medicare plan that allows you to choose your doctor. I know this is so confusing. This is so confusing for our seniors. This is super confusing for me, and I'm a doctor who's been working in the system for like over 20 years. So I just have a goal to learn more about this, and I promise I'll keep updating you with different videos about how it would be best to potentially readjust your Medicare coverage if you wanted to join a direct primary care practice or come to Blossom Health. So what you'll need to do is still enroll in April or May when that starts, but you'll have to know that I wouldn't be able to onboard you to the practice until July 1. And then you also may want to change your selection or options that go supplemental to Medicare when it comes to open enrollment time. To summarize, so this lack of access to Medicare patients, again, is something that is causing me and my patients a lot of distress. I wish I could fix the problem, but I have decided that in order to help continue to fix the problem, I need to get out of the system. And I am working locally and nationally to try to continue to improve reimbursement for Medicare, to try to preserve our Medicare system for our seniors, and I'll continue to do that. But in the meantime, at Blossom Health, I will see Medicare patients through a direct primary care model, but the office visits would be covered by the direct membership and not by Medicare. I hope this helps answer some of your questions about Medicare and direct primary care. And if you have more questions, please email me at hello@blossomdpc.com. Thank you.